When preparing to provide supplemental oxygen, I need to make sure I have all my equipment. This is my oxygen tank, my regulator, my non-rebreather mask, and my nasal cannula. Keep in mind, the non-rebreather mask and the nasal cannula have to be given to patients who are breathing adequately because they are passive delivery systems. So they're not going to help your patient breathe better, but they are going to give them supplemental oxygen. So when I begin, I'm going to grab my oxygen tank and make sure that when it's standing, I always have one hand on the tank at all times. If I need to take my hands off, I'm going to lay the oxygen tank back down. Oxygen tanks have green on the top. That's how I know this is oxygen. And then I'm going to look at it and make sure there's no damage to the bottle. I'm first going to crack the bottle to make sure that there's no debris. And then I'm going to take my regulator and I'm going to place it on my oxygen tank. When looking at your regulator, you have the screw on one side and you have this O-ring and two prongs on the other side. So when you line it up with your oxygen tank, make sure it aligns with the hole and two prongs on this side. So we're going to put it on, make sure it fits, and we're going to screw it hand tight. Then we're going to do one full turn and we're going to listen for leaks. My oxygen tank is on now, so if the regulator was not perpendicular and perfectly seated, I would be able to hear it. It would sound like oxygen was coming out of the tank. I don't hear anything, so there's no leaks. Now I'm going to read my PSI off. It should be between 1,000 and 2,000 PSI. If it's lower, we want to replace our tank. Now I'm going to take my non-rebreather and I'm going to hook it up to the tree. This piece right here is called the tree port. That is where we're going to hook up all of our different oxygen therapies that we use in this class. This, if you look, has numbers right here as you scroll on it. That gives us our flow rate and allows us to change the liters per minute that we want to put on our oxygen delivery systems. Now, I'm going to hook up my non-rebreather to the tree. To the tree. Make sure it fits well. My non-rebreather can be anywhere between 10 to 15 liters per minute. So I'm going to put it at 15 since I want high flow oxygen. I'm going to cover the little hole to make sure that I pre-fill the reservoir bag so that way my patient is definitely receiving 100% oxygen. Then I'm going to say, sir, I'm going to put this on your face, just breathe normally. I'm going to place it over his ears, cinch the nose down, and pull on these straps to make sure it fits well. And when he's breathing normally, I know my patient has supplemental oxygen. When preparing to use a nasal cannula, the steps of setting up the oxygen tank are the same. The only difference is we change the flow rate. For nasal cannulas, the flow rate should be anywhere between 2 to 6 liters per minute. We usually start at 2 and then titrate up as necessary. So I'm going to grab my oxygen tank, turn it on with one full turn, listen for leaks. I don't hear any. I'm going to read out my PSI between 1,000 and 2,000. And then I'm going to grab the end of my nasal cannula and hook it up to the tree, make sure it fits correctly, and then put it at 2 liters per minute. When you're doing this, you want to make sure that you can hear oxygen coming out of the nasal cannula. You're going to, if you look at them, they're shaped like vampire teeth. You want to put them into the nose like the vampire teeth are going in. So you're going to go into the nose, around the ears, and then tighten to make sure that it fits, and tell your patient to breathe normally.